This is part 2 of Unit K. Part 1 was structure function, the heart parts, and if you haven't looked at that yet, I would recommend going back to do that. Part 2, we're going to look at the nervous control of the heartbeat, talking about the SA and AV nodes. And then finally ending off with blood pressure. So just a reminder, if you haven't looked at, labeled, and if you don't know the heart parts, you need to go back and do that first. As well, I recommend when you look at the heart, I like to draw it out as 4 squares in a box, and if you draw it, you know it, and if you don't draw it, then you really don't know. So I also recommend doing that. But right now, what we're going to talk about is how the medulla oblongata, the part of the brain, which is found at the top of the brain stem, and the medulla oblongata is referred to as the reflex center of the brain. It's not the conscious brain, so we don't consciously control our heartbeat. Reflex center is going to send a nervous message along a nerve called the vagus nerve. The vagus nerve sends the nervous message into a node called the SA node. And the SA node is nerve tissue, and this is going to set the pace, set the rate of your beat, so it's called the pacemaker. So looking at this diagram, we want to know the order of events as the nervous message passes through the heart. So it begins in the SA node. The SA node causes 2 things to occur. First thing it's going to make happen is it's going to cause the right and the left atria to contract. This is going to push the blood from the left and the right atria into the right ventricle. The second thing it's doing, it's going to pass the message on to the AV node. The second node, also found in the right atrium, not as high up in the right atrium, it's sitting down a little lower. The AV node then passes the nervous message along through the bundle of His. We see it here. Okay, then this passes the message, the nervous message, on through the Purkinje fibers, and the Purkinje fibers cause the right and the left ventricles to contract. So we want to know the order of events in this nervous message. Looking at it a little bit differently, so the yellow is showing us the nervous message, the upper node, the first yellow dot, the SA node, sends on the message to the AV node through the bundle of His, and then on through the Purkinje fibers. We also want to notice when we're looking at this, right, that the blood is pooling in the right and the left atrium and then being pushed simultaneously, just about simultaneously, into the ventricles and then on from there. So good little visual. Okay, so the heart cycle, there are 2 parts to the heartbeat, and the first part is when the atria contract, and we're going to call this diastole. The second part of the heart contraction is when the ventricles contract, and we are going to call this systole. So when diastole is occurring, the AV valves are open, and this pen is giving me grief when I'm writing. Yeah, there we go. Thank you for... Okay, just going to try to go through it. So the diastole, again, for whatever reason, it likes to disappear, is when the AV valves are open and blood is moving from the atria into the ventricles. During systole, the semilunar valves are open and blood is moving from the ventricles out to the 2 arteries, right? The pulmonary arteries and the aorta. So AV valves open in diastole, semilunar valves open in systole. Blood pressure, right, is taken off of the brachial artery, the artery in the upper portion of our arm, and it's measured, the units, we should know the units, are millimeters of mercury. Normal blood pressure, there is a range of normal, is 120/80 millimeters of mercury. Above this number, we're going to call it hypertension, high blood pressure. Below this, right, we should know these words, hypotension. So the two parts of our blood pressure reading, 120 is the word we referred to when the ventricles contract. So systole is the pressure that is created in the second diagram when the ventricles are contracting. 80 is the number that is created, the blood pressure that's created during diastole, when blood is being moved from the atria into the ventricles. Okay, so 120 is higher because the ventricles are bigger. The ventricles, especially the left ventricle, is the largest, most muscular portion of the heart. It is what pushes blood throughout our body, so therefore it has to be a big, strong contraction. Putting it all together, we want to know diastole creates the pressure of 80. We want to know that the AV valves are open. The semilunar valves are closed. We want to know that blood is moving from the atria into the ventricles. In systole, we want to know that the ventricles are contracting. A pressure of 120 is created. We want to know that the AV valves are tightly shut, remembering the chordae tendineae, preventing inversion. The semilunar valves are now open. So problems with your heart that can occur, blockages in your coronary arteries would cause the cells of the heart that get blood from this artery to die. This would cause the other cells that are left behind to have to work harder. So this is going to increase your heart rate, increase your blood pressure, and it's going to stress your heart out. Over time, can lead to a heart attack, heart failure, death, right? And cures for this, they can cut out this blocked artery and put a new one in, or they can try to remove that clot by putting a balloon in, angioplasty. So this concludes Unit K and concludes what we need to know for this test. Have you filled out the PLOs? Have you looked at and labeled all the images? Have you completed and understood both the written and the multiple choice portions of the practice test? Hope so.